This is one project that if you talk about the integration of mental health into NTD's programming in Nigeria, you will have to talk about it. In 2020, WHO published a document which is a roadmap titled Towards Person-Centered Approach, and that's a document for the integration of mental health into NTDs. So our study is to understand how feasible it is to implement that document, or to use that document in our own setting. And for a start, we piloted this study in Benue State, north central Nigeria. And basically what we did is that we identified persons affected by leprosy and lymphatic filariasis, and this category of people are so important because they have skin NTDs, which is which exposes them to stigma, and because it exposes them to stigma and discrimination. And previous study have shown that this category of people have mental health is very common. When you talk about depression and anxiety, is very common among this category of people. So we identified the people, and what we did was to screen them for anxiety and depression, and we also did a training of healthcare workers. If you look at the situation very well from our own setting, what you will find out is that there are very few people that are available to look after the mental health needs of persons affected by leprosy, by extension, persons affected by NTDs. So what that means is that, for example, in Benue State, where we piloted the study, you will likely find just about 5 psychiatrists in the state, and all of them are working in the state capital. That's a state with a population of about 3 to 5 million people, and you have just professionally less than 10 people to look after the mental health, mental well-being of these people in the whole of that state. And that means that the people affected by NTDs, they live mostly in rural areas, and they will likely have no access to any mental health care. But by doing this, we mean that we are identifying healthcare workers, primary healthcare workers, who are supporting the persons affected by NTDs in those communities, and they are receiving some kind of trainings that helps them to understand mental health, that helps them to identify mental health situation, and the referral pathway is also defined for them. So when these people, they are not necessarily trained to become mental health experts, but they are trained to understand mental health. So they will now be able to identify mental health cases among persons affected by leprosy, and they can refer where necessary, and they can also offer some form of psychosocial support where that is needed. So this document is there by WHO, but the most important thing is whether the country is interested in adopting it or not. So by the virtue of our study, we presented our findings to the federal government of Nigeria, and together in the federal government, in collaboration with WHO, did invite stakeholders together, and the toolkit was now designed. So the Federal Ministry of Health in Nigeria is now championing the integration of mental health into NTD's programming. And this also was presented by a representative of the Federal Ministry of Health in the NNN workshop that was concluded in September in Tanzania. So it's very interesting that through our work, the federal government of Nigeria is also taking ownership and the federal government is now interested in integrating mental health in Nigeria in the NTD programs. So the documents are very much ready, and they are in the very final stages of being made available or gazetted, if you like that word, and then they will become a document to be used in the healthcare system in Nigeria. Yes, very much, because I think there are a few other countries that are now interested in this. I can say that Liberia, there is a similar thing going on in Liberia, and Ghana, for example, this development of the toolkit. ALM, that's the American Leprosy Mission, also showed some level of interest in what is happening in the Federal Ministry of Health in Nigeria. And by extension, that actually means that because ALM works a lot in Ghana, and there are discussion about implementing similar activity in Ghana. So I don't know much about it, but I can confidently say that other countries are interested in this, and we begin to see countries implementing this. But very much what is of importance to us is that we are pioneering this, and that's something we can pat ourselves in the back and say, well done. Yeah, that's because first, there is a synergy between us and the government. The government has been very much interested in the things that we do, and because we have provided an evidence, we first of all, we didn't just provide a theory to the government. We did a research, we came up with evidence, and the government saw the result, and they are very much interested in it. So possibly that's why it seems to be working. It's very much clear that the mental well-being of persons affected by NTDs is very important, and the fact that there are no much health professionals that are readily available, but this is now an alternative. This is an option, because if you look at how to fill the gap, you can imagine how do you want to fill the gap that you don't have much health professionals available to do a certain thing, and there's a very large population to cover, and it's very expensive to train psychiatrists, and not many people that are trained as psychiatrists will want to live in the rural area, because the prospects are very much higher in the urban areas. So but to get people who are already in the rural areas as health workers, who are very much interested, who are already used to the people in the rural area, just to add something to their knowledge. And I must say that the health workers, the primary care workers in the rural area, are also very excited that their capacities are being built on another thing, that they now have capacity to understand mental health. They now have capacity to address mental health problems in their own community. So it's a plus if you look at it from all the angles, all the possible angles. Yeah, so what we do in Nigeria, there are a lot of things that just speculation. Yeah, there are a lot of things that people might think, I know this, but the reality is that there is no evidence to back it up. The reality is that if you think about research output in coming from Africa generally, it's very low. is very abysmal. And if you look at diseases and all of that, you want to talk about Africa, but yet we don't have so much doing in research. And when you come down to Nigeria, you'll see that the research it's disappointing actually. So we are very much excited that at this point in time we are championing something. We are providing evidence that when you want to do something, you can look to us and say, yes, we have looked into this. We have given evidence on whether this works or that doesn't work. So it makes things easy. So for us now, it's a bit complicated because in the course of our research work, we do literature search, and in our literature search, you will find that there is not so much literature from our own setting. But at this point, we are now providing all so much of the materials that other people in the future can look at. We are also providing evidence for policy change. And another thing that we're doing is that we are also strengthening our capacity. So obviously there is so much that we are doing now, and it's quite interesting.